Hello, everyone, and welcome. Welcome to this audio podcast. Today, this audio podcast as part of Bostix Consortium. This audio podcast as part of a Bostix syndicate. This audio podcast as part of a Ztorm and Ostix front. And this audio podcast as part of the journal. And this audio podcast as part of a Ztorm Bostix production. Looking at a publication by Mohammed and team from in around 2020. A and a research publication, looking at is there a need for healthcare scientists and educational support surrounding chronic kidney disease and laboratory investigations and tests, summarizing polls via a patient support group platform. The publication again was published, the research was published in around 2020. So in this audio podcast, a look at in around the research question and in around the research gap and the sort of the research gap and the approach, and a look at the sort of research question, the research question strength and some and limitations. So this publication aimed to investigate the perspectives on educational support surrounding CKD or chronic kidney disease laboratory investigations from a sample of the Renal Patient Support Group RPSG platform. Uh, the research question was wherein the publication looked to understand perspectives surrounding healthcare scientists' involvement across chronic kidney disease or CKD healthcare services from a sample of the RPSG, and the research involved uh, involved uh, involved uh, involved involved sorry involved quantitative involved sort of quantitative data collection in implementing five polls to help investigate some of the challenges across CKD services. In addition to the use of social media, the research the publication was within the remit of social media use, and in on patient and public involvement, where the publication looked to offer some solutions. In As part of the sort of strength of the publication, provides a sort of an overview of the challenges that links both frontline healthcare professionals and laboratory medicine or pathology services, and the publication also informs of smarter working that would look to meet challenges in context in around primary care to support in around support of chronic kidney disease or CKD recipients. The limitations of the publication was that the limitation of the publication was the publication informs in on only some aspects surrounding the use of social media and how this could help achieve integrated services surrounding kidney disease, and through the data through the data through the data through the data there is a sort of a descriptive snapshot, snapshot, and has and whilst there is a validity, the data is not generalizable, and the design of the publication could have also included data from pediatric or young people cohort, at least in context of digital healthcare. Again, case study for health professionals or healthcare professionals would have been advantageous. That draws this audio podcast to a close. This audio podcast is part of a Bostix Consortium. This audio podcast is part of a Bostix syndicate. This audio podcast is part of a Ztorm and Ostix front. This audio podcast as part of the journal, and this audio podcast as part of a Ztorm and Bostix production.